chasing what's not real.
Hi, I'm Frida. I'm a graphic designer and a marketing manager, and today I came for the PRA filler treatment. Originally, I wanted to do breast enhancement, but it was too invasive for me, so I heard from a friend about this treatment, and that's where I ended up with Dr. Reza doing the PRA filler treatment, and I am very happy with this decision.
Hello.
Hello.
How have you been?
Good and you?
Good, thanks. So, we've been getting information about how you've been. You said you're feeling fine, you had a little bruising, but nothing crazy.
Yeah.
Okay, perfect. And you're feeling like it's all still giving you what you needed, it's not kind of size there.
Very nice.
So that's what we want. We just make sure that everything's fine. So what we'll do, I'll give you a minute and then you can get undressed. What I think we can do is put this over here, just so that you know. Cool.
So when I got here, I was very nervous as I'm very scared of needles, and this would be a first for me. They worked very well with me. They made me very comfortable. They cover up the parts that you need to be covered up. It's only you and the girls. They talk you through the procedure, and then they take your blood first. And then they do the procedure where they make your blood into the PRA filler. And then they use a numbing spray on the sections where they would spray on your breasts. You don't actually feel it, it's just a cold sensation, so it's very nice. And the day after, I would say it's a bit uncomfortable because it's not a usual spot that you would be injected in. So it does feel a little bit different than it usually would, but it's not uncomfortable, it's not sore, it's just something is there. But I wore the same clothing, same bra, everything was fine. It's a very cool procedure.
What we're really excited about for what we've done with Frida is we're using platelet-rich fibrin fillers. So basically we make a gel out of the blood. And it's really great because we're not adding anything into this mixture. It's purely her own blood. We just process it in a way that it's still her own blood, but we're able to form a gel that's safe for us to use into the skin. There used to be a type of hyaluronic acid filler that was available a while back. And the problem is, when you injected that into the actual breast tissue, you would create fibrosis and scarring. And so everybody stopped doing that. But now, at least with platelet-rich fibrin fillers, we have something that we can use. So it's very important that nobody ever puts hyaluronic acid into their breast. It's a very bad idea. So what we do is we use this gel and we keep it safer by injecting platelet-rich fibrin in the fluid form directly into the breast tissue to stimulate those glands to increase in size. And we use the platelet-rich fibrin gel in the actual skin to thicken the skin, make it more dense, and then it feeds those platelet-derived growth factors both into the skin and into the breast tissue.
Really?
Is it even equally stiff? I didn't even look.
It's good.
I'm very finicky, hey? It was just for you guys and like, wow. Now I feel like I'm superstar.
Yeah, very good. Okay, fine. So now to take some pictures. You can take some pictures just to keep track.
Yeah.
So if you feel like you want more, we can actually, after like even a month, we can add more layers, because theoretically it's just about how much blood you make and how much we can extract from there and how long your body keeps on the actual filler. But remember, there's still that process of feeding growth factors into the breast tissue and into the skin. So that process is still happening now. Maybe 3 months and it might be 6, and we'll see over time which one it is. But as it goes, we'll be able to decide whether we need more. That will determine what the actual limit of this is. So if you want more, we can actually do more. Just wait a month.
Perfect.
Well, a month from when we did it.
Yes.
But when they do the injection, they go basically around your whole breast. So they start at the top, and they do, I think, 2 or 3 at the bottom, and then 2 or 3 on the side. But once again, the doctor asks you, do you want more filling up here? Would you like them to be equalized? He's very for you as a patient. So I said, just go for it, whatever you think is best, and he did an all-rounder. So I had a few at the bottom and a few at the top. I didn't experience really discomfort. I had a little bit of bruising, but it was minimal. I think it was 2 spots where it would be your most painful spots on your breast, and for me it was on the inner side. So I had 2 very small blue spots, which went away in 3 days' time.
You know, you asked me before about symmetry.
Yes.
No 2 people have the same. So if there's 3 billion women, there's 6 billion breasts.
Yes.
Because it's like our faces, they're not symmetrical. But close to symmetry looks better. So what we'll do, there's certain areas where we can work, like along the middle here, along the top and the outside, and we'll base our injections on what you're seeing in the mirror. So you can also have a look at home.
Okay.
And you can come and you can tell us, I feel like this one's got more volume here, and we'll inject according to that, so that each time we inject, we push you closer to symmetry.
Perfect.
As long as you know you'll never get to 100% symmetry. It doesn't exist, and you shouldn't aim for it, but closer to symmetry is fine. So, and I'm happy, I'm excited, and it's looking good. So let's see how you go.
Thank you.
Good.
I've heard of Dr. Reza before, but through other treatments. Never thought of him doing any treatments like this. So when I heard he did it, I was very happy to hear about it. It's more for confidence, to have a natural look, for feeling better in your clothing and not having that very big enhancement of plastic surgery. So yeah, just more confident.
Perfect.
Good, now we can compare it to the befores more easily. Perfect, thank you.
Thank you
So as long as you're happy, we're happy.
Very happy.
Nice,
More than
thank you. We can put this back on.
Shine.
The other nice thing is you can take 500 milliliters of fluid safely every 2 months, as long as a person weighs over 52 kilograms. And that's quite a lot of volume that you can increase somebody's breast size by. The other added benefit versus, in surgical changes you need to do, choose a size and implant it, and that's a whole surgery. But if we decide we want to do 10 milliliters at a time, you can do that each month, 20 or 30. So my plan with Frida is to build it on continuously over time and see how much we can get, which limit we can reach. And she is going to be very excited about this. I'd like to hear what she thinks when we're done. So nice to see you.
And you too, and you too.
I'm very grateful that you're willing to do this.
No, why
It's
not?
quite exciting. We want to have interesting cases and people on our show, and that's you.
Yes, I know.
Come, I'll show you the way.
Yeah. So my name is Petrus Johannes Janse van Vuren. As they call me Pete. I'm a senior professor. I'm at WITS and UCT and at 2 of the universities in New Zealand. I specialize in master's and doctorate degrees. I do advanced technologies. One of the things, as you get older, I started getting penile withdrawal. It's very dangerous, could cause cancers, could obviously very uncomfortable. Since I'm getting younger, I needed other parts of my body to at least stay younger as well. Dr. Craig actually then said, look, you've got a doctorate in advanced technology, you will like this stuff. So he recommended Dr. Reza. He says for the simple reason, everybody that they've recommended to Dr. Reza has been a success story. I started off coming here most probably 3 years ago. The P-shot was still PRP. From the first time, it started making a difference. It sort of was less withdrawn. The muscle that holds it actually in place, that sort of gets weaker, sort of started strengthening. The difference was so phenomenal that in the beginning I came once every month. It's just like, there's nothing like seeing the results of something, and especially of something new and something technology. We've been doing the injections with the platelet-rich plasma for a long time in different parts of the bodies, and obviously one of those areas is the penis. What we want out of that is for the growth factors to actually work in the tissue. There's vascular growth factors and there's general growth factors. So the one thing it'll do is to improve the tissue quality and get the blood vessels to enlarge and grow and become of a higher quality. The structure of a penis, it's basically got networks of vascular sinuses. And when these get filled with blood, that's what gives us the firmness. When you have problems with that, or blood going in or blood going out, you actually start to get erectile dysfunctions. When you do inject the platelets into the tissue, it spreads up and down because it's not closed compartments, it spreads up and down. This is my model. We only need to do 2 shots in the base, 2 shots in the middle, and 2 shots at the tip, because that goes into the other tissue, what we call the corpus spongiosum, or the softer tissue. And it spreads through the entire structure. And one of the unexpected side effects, maybe it should have been expected, is that you actually get a growth in the size, in the thickness and the length of the tissue, because you're stimulating with the growth factors and the vascular growth factors. And so, as you'll hear
from our professor is that we were expecting something around 20% and we got more along the lines of something like 80%, which I would never offer or promise or advertise to any new patient. It's just that with time and with effort, you can actually get some unexpectedly good results. So we use the P-shot to enhance the functionality. So we talk to the patients about getting a faster erection, about lasting longer. So we tend to be able to get patients to reduce their likelihood of premature ejaculation.
It improves everything, right? Your stability, your erection, literally the size. When by the time I saw Dr. Reza, it was like 2 inches. But now you've got a very healthy organ. I mean, it's like 5 times the size of what it was. So I'm comfortable with the size. I wouldn't say do it to grow it, but it won't harm, okay? But absolutely, your appetite changes completely, because you've got an organ that works. The way he acts and the way he explains the procedure also calms you down. It is not as invasive as it sounds, right? So you open your private parts, basically. He immediately puts almost like a plastic sheet with a numbing on you, right? He will then cover you up with a towel or something and then takes the blood. Obviously, with a PRF, it's a lot more of a speedy thing because they have to spin the blood quicker. They take the blood, they spin it. Dr. Reza then comes back with the vials and basically just inject it into the penile area, and that's it.
We have patients doing this all the time, women and men. I think that with women, it's more likely postmenopausal women who have had or post-pregnancy and they are experiencing problems with the function, with painful intercourse, that type of thing. And so they'll generally need the treatment. With the men, I find sometimes it's a little bit of curiosity. They'll say, I wonder what that's like. Let's go and have a shot. And so some people really like how it works and they'll keep on coming and they'll do maintenance with it. So probably 2 to 3 times a year. Some people will feel like, oh, it was nice, but it's not for me. And I always go back to that normal distribution curve. But for each one of the lucky patients you have on that side, you have an unlucky one on the other side who will say, oh, I don't really like how it went. And so just doing it once is kind of the best way to tell which side of that curve you're on.
I can tell you my sex life in my 40s and my sex life now is completely different. If you say to me, where am I moving to? I'm moving back into my 30s. From that perspective, 100%. It makes a difference in how you feel about yourself. It makes a difference, the bounce in your step, just like everything else. And it really, really, really works.